Hello, everyone, and welcome to the Surveillance Advances Seminar Series 2024 to 2025 season. This seminar series is co-hosted by the Public Health Agency of Canada and the National Collaborating Center for Infectious Diseases, or NCCID. The title for today's seminar is Vision 2030, Moving Data to Public Health Action. My name is Robert Sager, and I am research staff at NCCID. I will be your moderator today, along with Chayu Lin, who is a senior policy analyst in the Data, Surveillance, and Foresight branch of the Public Health Agency of Canada. The NCCID is funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning, programs, and policies related to infectious diseases. We are incredibly pleased to be co-hosting the series with the agency. Both Chayu and I are joining you today from the city of Hamilton, situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississauga peoples. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and Anishinaabe to share and care for the resources around the Great Lakes. Today, Hamilton is home to many Indigenous peoples from across the Turtle Island. We honor the Indigenous peoples who have lived on and cared for these lands for generations. We are grateful for the opportunity to share and call this place home. The Surveillance Advances Seminar Series has welcomed participants and presenters from coast to coast to coast since our inception in September 2023. While surveillance is the most common term used in public health to describe the process of tracking health events and determinants through the collection, analysis, and reporting of data, due to concerns over its connotations, some have suggested the use of other terms, such as public health assessment. We acknowledge that there is still an ongoing dialogue about the use of the term surveillance in public health. For the time being, without a widely accepted term in the literature, we would like to note that we use the term surveillance in the series title to refer to the assessment of and response to public health threats as a core function of the public health systems. Before we dive into today's seminar, there are just a few housekeeping items I would like to mention. First, a recording of the seminar and presentation slides will be available shortly after the seminar on the NCCID website. That's nccid.ca under webcasts. Second, the chat box for participants has been disabled for this session. The hosts will be using the chat box to communicate additional information with you. If you have any technical problems with Zoom during the seminar, please email us at nccid@umanitoba.ca. Finally, please send in your topic-related questions using the Q&A tab, and we will try to address as many as possible in the discussion period after the presentation. You can like any of the questions to push them up in priority. We would also like to note that Surveillance Advances is a Section 1 self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. The seminar series is also approved by the Council of Professional Experience for Professional Development Hours for members of the Canadian Institute of Public Health Inspectors. If you require a letter of participation for your attendance today, please look out for the survey that will be shared after the seminar. Now, with excitement, I would like to introduce and welcome our speaker. Today's seminar will be presented by Dr. David Buckridge. Dr. Buckridge is the Executive Scientific Director of the Data, Surveillance, and Foresight branch at the Public Health Agency of Canada. He is also a professor at McGill University in Montreal, affiliated with the Department of Epidemiology, Biostatistics and Occupational Health, the Department of Medicine, and the School of Population and Global Health, as well as the Chief Digital Health Officer for the McGill University Health Center. Dr. Buckridge holds an MD from Queen's University, a Master of Science in Epidemiology from the University of Toronto, a PhD in Biomedical Informatics from Stanford University, and is a Fellow of the Royal College of Physicians and Surgeons of Canada, with specialty training in public health and preventive medicine. He is also the Tier 1 Canada Research Chair in Population Health Informatics. Dr. Buckridge has consulted on surveillance to organizations such as the Public Health Agency of Canada, the U.S. Institute of Medicine, the U.S. Center for Disease Control, the European Centers for Disease Control, and the World Health Organization. Dr. Buckridge is also the co-chair of our Surveillance Advances Seminar Series. At our inaugural seminar in September 2023, Dr. Buckridge introduced the Public Health Agency of Canada's Vision 2030 initiative, and today he'll be sharing with us an overview of the Vision 2030 development and the final report that will be releasing soon. So thank you so much for joining us today, David. The floor is yours.
Thank you very much, Robert, for that very kind introduction. And it's my absolute pleasure to be here to bring back to you, that we're all attending today, an update on where we are, just really on the eve of the publication of this report about, as it says, moving data to public health action and printing a vision for 2030 for what we'd like to see public health surveillance look like in Canada. Next slide, please. So just to begin, I mention here or list here a number of my sort of affiliations or interests. I don't think any of these pose a direct conflict, but just to be transparent, you can see where I'm employed and the different types of agencies that support my research. Next slide, please. So for today, we have 3 objectives for those of you who are listening. The first is to gain a little insight into really how we went about doing this project, which, as you'll see, involves some fairly extensive collaboration with public health practitioners and leaders across the country to build a collaborative vision for public health surveillance, looking forward to the date of 2030. That's the first objective. The second is to really understand exactly what the vision is itself, the components of it, which we'll get into this. There's obviously a statement. There's some characteristics of what that future state should look like, and in particular, this framing of public health surveillance in Canada as a system of systems, and we'll explain what that means. And then the third objective is to kind of move a little bit beyond the problems and the vision and think about, so what can we do now? And that's really to get into these, what we've called opportunities for action. So these are areas where we see movement already in the country, and they're addressing some of the challenges identified, and we think it's feasible to move farther in that area or in that way forward, and we think it's going to have impact. And so we'll go through 10 of those areas or opportunities, sorry, for action as well. So those are the 3 objectives. Understand how we did things, understand the vision, and understand what we can do about it. Okay, next slide, please. So the background, so this is really one of 3 major initiatives approved within the branch that I'm in, and particularly in the Public Health Agency, around building towards their 2023-2025 surveillance strategic plan. Well, actually, it was part of, the 2023-2025 strategic plan. And as we'll describe as well, this vision actually creates also a bit of a northern star or a direction to go to in future planning activities. The goal of this initiative, though, just to sort of frame the way it was done and what it's, how it's anticipated to be used, is it's aspirational. So this is not meant to be a vision that commits anyone to anything. It's meant to be a vision that all of the people we consulted with have gotten behind in a sense and can see the imperative and the value of going there. And it's meant to be inclusive. As I said, we met with multiple people from multiple organizations, multiple perspectives. And so it's not meant to be a top-down view from the agency, public health agency, of where we should go. It's really meant to be an inclusive and shared perspective. However, as I mentioned, being the aspirational, it's non-binding. So we're not trying to really force anybody to do anything. This is meant to be a sort of a vision that people can get behind, and it's a sort of a convergent evolution is the way I like to think about it, so that we're hopefully all moving in a direction that we agree is a good direction to move in. And finally, really based on prior work in this space, and there's been a lot of prior work in this space, we really took the decision early on to make sure that we were action-oriented. So we didn't just want to document the problem and set a vision. We also wanted to be clear about what kinds of actions could be taken. And so, again, these are not recommendations necessarily that the agency or any other partners in the Canadian surveillance landscape ought to do. We're really just sort of pointing out opportunities, and we think it's going to really be up to further discourse across different aspects of partners involved in surveillance in Canada to determine where to really lean into in terms of these opportunities. And I should note at the outset that this process has been advised by a group of experts, the Surveillance Expert Roundtable, that very graciously offered their time to provide feedback as things advanced. The National Collaborating Centers, including the National Collaborating Center for Infectious Disease, which is hosting this seminar series, really were core and really important in moving forward with this whole project. And really, there's also much engagement with provinces and territories through the consultations we did, but also through existing governance tables. So there's been a lot of engagement over the course of the last year. Next slide, please. So out of all that consultation, and this is all documented in much more detail in the report for those of you that want to get a little more information. But as you can see summarized here, some of the outputs from this process prior to the final report. This comes from, as I mentioned, a lot of engagement. Over 1,800 participants provided input to this in different venues, public venues, some technical discussion, as well as in response to an online public consultation. You can see also there are a number of commission papers, which I really encourage you to connect to the websites of the NCCs, both in terms of infectious diseases, but also National Collaborating Center for Methods and Tools and National Collaborating Center for Indigenous Health, all contributed papers through their networks. We had a Best Brains Exchange, which is an opportunity funded by CIHR to invite people from around the world to tell us what they think we should be doing about surveillance. And then we've had a number of sessions also in different settings, like the CPHA meeting, for example, to present what we're doing and get some feedback. So just to point out that even though the final report's about to be posted, there's a lot of other supporting material here that I think is quite helpful and useful as we think about where to go with surveillance in Canada. Next slide, please. So I'll just pause here for a second. So these are the challenges. And, this came out of, I should point out, these 6 persistent, enduring challenges came out of all of that consultation, documentation, extensive qualitative review. Nonetheless, I don't think they come as a surprise to many people. But really, we did, I think, a very good job in the report of really understanding why these are problems and documenting where they're coming from. And that was actually also very helpful work for being able to identify opportunities. But what I'd like to do right now is just pause and give those of you that are watching an opportunity to just weigh in with your thoughts. So I think we're going to start up a poll. And the question really is, which one of these 6 persistent challenges is sort of most important or resonates the most with you in your current role? So let's just take a minute here and get some feedback there. So please just click. For many of you, it may be all 6, but please click the one that is the most important or relevant for you. And then we'll give you a few seconds to do that, and then we'll report back what we heard before we move on to the next step. So I'll just give you a few seconds to vote. And maybe while you're doing that, I can just sort of add a little bit of commentary. We will, as for the rest of this presentation, actually really get into the opportunities for action. So this is your chance. And when I show you the opportunities, I'll also indicate which of these challenges they are addressing. But as you can see, the first one, maybe just to give you a little bit more context, really is the purpose and governance of surveillance. So we hear from a lot of people that it's not always clear why they're doing certain things in surveillance systems or what the objectives of a given surveillance system are. And so this was really driven a lot by that kind of comment. The partnerships, collaborations, and engagement, I think, is fairly straightforward. As you know, WHO put out a report recently about kind of a collaborative perspective on surveillance. And so I think, in fact, many people see surveillance as fundamentally a collaborative exercise, but we really do need to have mechanisms to support that. The third area is about building respectful partnerships with First Nations people, Inuit and Métis people, and communities and other organizations. This is an area we heard repeatedly as a challenge, and so obviously it figures very prominently in our report. Workforce competency and training resources really just speaks to the skill sets of the people involved in surveillance. Data quality and access and use, of course, always a challenge. And then finally, strategic use of technology tools, platforms, and methods. Okay, so I don't know if do we have a kind of a tally of where we're at yet in terms of responses? Oh, here we go. Thank you very much. Okay, wow, so fairly evenly split. I think all of you hopefully can see the results, but we've got about a third of folks chimed in with number 5 in terms of data quality, access, and use being the most important or most prominent. And then I would say almost equal numbers across partnerships, number 2, and number 6, the use of IT. And then we have also, I think, very important numbers on workforce and also around building respectful partnerships. So thank you very much for that feedback. It's good to hear that these do resonate with you, and interesting to hear that there's a little more emphasis perhaps on the data quality issues and access and use than on the other 5. Okay, great. So let's close the poll and then we'll move on. And I'd like to get into the vision first and then the opportunities for action. So next slide, please. So what does the vision include? Next, please. So we start with a statement, which I hope is not too controversial. Just to highlight a few aspects of this statement, of a system that we would like to see in 2030. And when we say system here, we speak in some sense about individual systems, but we also speak about the broader ecosystem, which is the collection of surveillance systems in Canada. And we want those systems in the overall collection to be adaptable and collaborative so that it can change and also work in a collaborative way. And then we introduced this concept that was actually brought forward a couple of years ago in one of the Chief Public Health Officer of Canada's reports about a system of systems. And I'll get more into this in a second, but essentially this refers to the opportunity for individual surveillance systems to retain individual control within their organizations, but to interoperate more effectively. And I'll come back to that in a second. And we think it's critically important too in this vision that not only do we have this system of systems adaptable and collaborative, but of course it's able to provide timely insights for actions that are going to improve health, reduce inequities for all people in Canada. Okay, so that's the vision statement. Next slide, please. And I'll just unpack this concept a little bit for you of system of systems. So what you see on the right are other aspects of the vision, the desired states and the characteristics that we'd like to see for this system. And I won't go through those, but I think, again, these come out of a lot of consultation and discourse, and they're meant to really succinctly summarize as best as possible different perspectives or aspects of what that surveillance system and system of systems should look like. The graphic you see on the left is meant to summarize this concept of a system of system. So every circle, and you can see one of them is kind of blown up a little bit larger there, is meant to indicate an individual surveillance system. And you can see in that sort of whirl inside that circle is the surveillance cycle and kind of a process perspective that you can see. And then what we're trying to show with the different colors inside of the circle on the left, the big one, is that these surveillance systems are operating in different contexts. So it's one of those colors might be a provincial territorial level, one might be a federal level, one might be amongst other stakeholders involved in surveillance. The idea is that they're operating in some sense together or some degree of interoperability potentially between those systems. But there is a need, obviously, for information to flow and perhaps data as well between these different domains, provincial territories, federal level, other areas. And the system of systems is really just saying that not everything has to connect with everything else, but there is an opportunity to do more if we're more coordinated, essentially. And to get there, what you need is some kind of overarching governance, some guide as to where we want interoperability to happen, and of course, the value proposition. Why do we want that interoperation to happen, and what's the value to all the players involved? So, we're already doing this to some extent in the country. There's been a lot of discussion over the years of federated surveillance, and this system of systems approach really builds on that framing because the idea is that all of the systems that are out there, they remain under the control of the people that operate them and have the authority to operate them. But we're talking really about being a little more clear and conscious about how these systems ought to align, both in terms of how they function and methods and standards, but also how they ought to share potentially data or information across the systems to provide us with an opportunity to really meet that vision that we described in the previous slide. Okay, so I'll leave that there, but happy to come back to that if there's any questions, of course, as we have our question and answer session later on. Okay, next slide, please. So now I'm just going to go through these 10 opportunities for action. We'll summarize them and give you all 10 of them at the end, but I'm just going to go through them one at a time to start with, and then just talk a little bit about an example for each one. And this is really just to sort of whet your appetite, as it were, because there's much more written in the report if you want to dive into any of these areas. So this first area is about really it directly addresses the first challenge. And so for each of these opportunities, you'll see we'll have the opportunity on the left, a little text description of the opportunity on the right, and then you'll see at the bottom which of those challenges we think this opportunity is addressing. And of course, it's not a one-to-one. There are sometimes many challenges addressed by a given opportunity, and you may have a different perspective. This is not a perfect science to draw these connections, but the point is these opportunities really can address probably in many situations more than one challenge, and we want to think about that in terms of where we want to put our effort. So this one, as I mentioned earlier when I talked about the challenges, really addresses this theme that we heard from people about the sort of lack of clarity sometimes as to what the objectives were of a surveillance system, or even for people working within a surveillance system to know why exactly they were doing certain things, and certainly for people sometimes outside of surveillance systems to understand, including in communities, what's the purpose of this system. So one way to address that is to be clear about the governance framework. And it is possible to think about perhaps even creating example governance frameworks that could be shared across different systems to help with that process of clarifying the governance of the system and including the purpose of it. One example we talk about in the report is where the chief coroners, chief medical examiners, and others have really gotten together to come up with a new way to talk about and work together around national standards in death investigation. And so they really have created a sort of a collaborative governance in that context across provincial, territorial coroners and medical examiners, Public Health Agency of Canada, and Statistics Canada to advance that priority public health issue. Okay, so that's our first opportunity for action, is to develop governance frameworks. Next slide, please. Our second opportunity is about enhancing surveillance systems by integrating social determinants of health into surveillance. This is something that we heard, from a challenge perspective. We certainly heard these two challenges, both in terms of the purpose, but also data quality and use. And this was really something that we heard about in a very aspirational sense before we came to the opportunities, in that many people recognize the importance of having this data in all of their surveillance systems in a more or less standardized way. But of course, the challenge of doing it. And so here we're talking both about area level data on social determinants of health as well as individual level to the extent that they exist. And in fact, one of the opportunities for action we identified in this space is the work being done by the Canadian Institute for Health Information, where they've introduced an interim standard for race-based Indigenous identity that can be used in the context they introduced in the context of COVID-19, but certainly can be continued to be used in this context. Also, we know that Canada Health Infoway has also worked with the Canadian Institute for Health Information to try and develop standards for use of electronic medical records for capturing social determinants of health data. Again, that's the kind of thing that, if captured and communicated and percolated through the system, could ultimately be accessible to public health. So this is another opportunity for action, is really to try to, in a more holistic way, enhance all surveillance systems by bringing in or integrating and linking data on social determinants of health. Okay, next slide, please. So opportunity for action 3 is, I think I mentioned, of course, the two challenges down below, both in terms of partnerships, collaboration, engagement, and building respectful partnerships with First Nations people, Inuit and Métis peoples. And so this opportunity was really to try and foster collaboration and build trust within communities. We did have a number of examples of this one, but the one that we really highlighted in the report is in Quebec, where the Quebec government is supporting an integrated approach to address the use of antimicrobials and their resistance through an interministerial collaborative action plan. And that really focuses on animals and human health, and also developing a public-private partnership with relevant communities, including veterinarians and feed mill owners. So really trying to bring together all the different stakeholders involved in this context, in this surveillance context, to, as the opportunity says, foster that collaboration and build trust. Next slide, please. So opportunity number 4, this is one that addresses the 3 challenges, or to some extent, 3 challenges, or touches on the 3 challenges below. And this opportunity is to create the conditions to implement First Nations, Inuit, and Métis health data sovereignty. And so there are many examples across the country of work in this space already underway. One example is in the Quanipita National Inuit Health Survey, which is an Inuit-owned, Inuit-led national program that is formed by Inuit knowledge and includes participants from all ages and communities, including in urban centers. So there's many ways we can go about this. That's one example. But I think this is actually a very important opportunity for action. As you can see, it touches also on the issue of data quality, access, and use, because for health data sovereignty, we really need to make sure that that data can flow and be owned by the appropriate entities within this surveillance ecosystem. Next slide, please. So opportunity for action 5, again, touches on partnerships, collaboration, engagement, the third challenge you see there, and also workforce. And here we're talking about the opportunity to enhance the capacity to conduct surveillance in a manner that values and strengthens and incorporates First Nations, Inuit, and Métis knowledge and skills in public health assessment and response. And we had a lot of really good discussions, and I would also point you to those 2 supporting papers from the National Collaborating Center for Indigenous and Health to really unpack a bit more of this issue and the opportunities. I think what this highlights for me, though, this opportunity, is that we have to acknowledge there are different ways of seeing health and seeing surveillance from First Nations Métis communities and from the Public Health Agency, for example, or other public health organizations. And so to really enhance the capacity for these peoples to do, for First Nations Métis people to do their own surveillance, we have to acknowledge those different approaches, and we have to support what the best for both in some sense, right? So one example here is through an appointment of Indigenous adjuncts and the establishment of elders and knowledge keepers, the University of Alberta School of Public Health has an Indigenous Reconciliation Initiative that supports Indigenous and Northern students in pursuing public health education and training in research and community engagement. So it's about capacity enhancement as well as building those collaborations. Next slide, please. So on to the sixth opportunity for action. So this is really about investing in health information systems, infrastructures, and indicators in First Nations, Inuit, and Métis settings. And so, we've spoken a bit already about data sovereignty. You may have heard about the concept of OCAP. This is really about ensuring that these communities have the systems and infrastructure they need to own the surveillance activities that they will lead and direct, and also to ensure data sovereignty within those communities. The example I use here and from our report is the Our Health Counts studies, which have engaged Indigenous peoples in quote, by community for community is the framing, population health assessment and response. And it sets a strong foundation, we think, for collecting comprehensive and disaggregated Indigenous specific health data, which is retained, the ownership is retained by the community. Okay, next slide, please. So there's 10 of these, so we're moving through them. I've got 3 more, and then we'll have some time to summarize and discuss. But opportunity number 7 is really one that sort of directly addresses that challenge number 4, workforce competencies and training. This is an area where we hear again and again, given the pace of change and the demands of people in the surveillance system, how do we ensure that people are sort of skilled up and have the right mix of people with skills in the organization? And so this is something that, in fact, almost really actually in parallel to our consultations around surveillance, the National Collaborating Centers were leading a consultation too in partnership with Public Health Agency of Canada around the core competency for public health in Canada and a refresh of those competencies. And so that really is an excellent resource that I think really sort of sets some clarity in terms of where we want to go in terms of the competencies. But of course, there's still work to be done in ensuring that we have the capacity to train people with those competencies and get them into public health settings. Okay, next slide, please, on to opportunity for action 8. So this one is fairly straightforward. It's a bit similar in some ways to the one I mentioned about social determinants of health, but this is focusing just principally on interoperability through standards writ large. And so this really addresses to some extent the purpose and governance of surveillance, as well as the data quality, access, and use. And the purpose and governance is because really we want to think about what are the key elements of what we're doing in surveillance, how are our surveillance systems meant to, or could they work together? And then the standards that we want to bring into that ecosystem of systems really has to support the key aspects. So are these things, for example, like standards in how we talk about diseases and how we talk about geography and how we talk about social determinants, and at what level do we expect these to be shared between systems? So this is really, I think, an important area. And the example that we give about really an opportunity for action in this space is the Pan-Canadian Health Data Charter, which was finished just as we were actually starting this project. And that promotes a number of things, including transparency and common standards for secure transfer of health data in Canada. And many health organizations, including Canada Health Infoway, the Canadian Institute for Health Information, the Public Health Agency of Canada, and provincial and territorial partners are working to push ahead important aspects of that health data charter. And in fact, I think the work around data standards and interoperability is a key piece of that. What we're trying to highlight here is this opportunity is the need to take a surveillance system focus on that, and what aspects of that standardization and interoperability is really critical to achieve that vision of a system of systems. Okay, next slide, please. On to opportunity for action number 9. So this is going beyond the standards to think about the linkage problem. So it's good to collect data in a consistent way, but this opportunity is to really review more carefully how we share the data and allow it to be linked. So again, going back to this concept of a system of systems, you don't have much of a system if you can't, share your data between the systems. And so this could be between systems, for example, provincial, territorial level and federal, or even between provincial, territorial, or between a First Nation, Inuit, or Métis run system and a provincial territorial system, for example. In all those situations, we need to have, a legal framework, and we need to have a technological infrastructure, as well as the relationships to allow us to exchange data. Um, and the example that we use here is the work being done by the Public Health Data Steering Committee, which is an FPTI actually infrastructure, with partners across the federal government, provincial, territorial, as well as Indigenous partners. And what they're trying to do in this space is to modernize the MLISA, or Melissa, Multilateral Information Sharing Agreement, as a way to get more flexible framework for data sharing. I think that's on the governance side. I'll also just quickly say on the linkage side, we know there's also work being done, certainly more in the research space by groups like Health Data Research Network Canada, to try and look at ways to advance data linkage. And we're also seeing activities in many jurisdictions to try to improve the linkage of clinical and epidemiological data for public health systems. So there's lots of activity in this space, but it's really, I think, a critical one for really bringing things together in a way that will allow us to really understand better what's happening in terms of population health and allow our surveillance systems to really reach what we've described in that vision. Okay, on to the last opportunity for action we highlighted, number 10. So this is really about modernizing data infrastructure. And, this opportunity speaks directly to this challenge. We heard a lot from people about, what's sometimes called the technology debt in public health. We're working with sometimes older or more, outmoded systems sometimes. It's sometimes hard to innovate and bring in new, exciting ways. And sometimes it even makes it hard to change our workflows because of these systems. So what's really critical here is to have a view to, a vision of where we want to get to, where the priority areas are, and be able to invest. And of course, have the people with expertise, as we talked about earlier, to really make sure we can go in the direction we want to. So the example we bring in here from the report is the Canadian COVID-19 Genomics Network Consortium, which had multiple partners, including Genome Canada and the National Microbiology Lab at the Public Health Institute of Canada. And they created the Canadian Virus-Seq data portal to facilitate sharing of SARS-CoV-2 genomic sequences in really a standardized way. So that's an example of a core platform that was stood up that really allowed us to do much better work in terms of bringing genomic data into surveillance. There are many other opportunities, but I think that's one that's worth highlighting. Okay, so that's gone through all the opportunities, 1 through 10 in order. As I mentioned, if any of those kind of piqued your interest to some extent in terms of trying to learn more about them, we do give a much deeper description of these in the report, in addition to the underlying challenges, and also we highlight more opportunities, examples in that report. So just to maybe kind of summarize, if you go to the next slide, please. So we went through these 10 opportunities. You can see them all summarized here. I won't read them out again. As you can see from the different colors around the outside, each opportunity addresses at least one challenge, sometimes up to 3 for some of these. And really, again, these are just to give you a bit of sense of how we came up with these opportunities. We did, as I mentioned, the wide consultation. We did a very careful qualitative analysis of all the feedback we had from the different consultations. And then out of those themes that emerged, our surveillance expert roundtable went through actually a Delphi process, a 2-round process, to identify opportunities that were feasible and likely to be impactful, and for which we knew there were things already happening in that space. And so that's how we came up with these 10 opportunities. Okay, so let's move on to just kind of wrapping things up, and hopefully we'll leave a little bit of time for question as well. Next slide, please. So just to give you a sense of where we're going, next steps. As I mentioned, we're really almost on the eve of publication. It should hopefully be this week or maybe early next week for the report. And knowledge mobilization activities are underway. We'll be presenting at the CPHA conference, for example, in Winnipeg later this year, and also at other relevant fora, perhaps at some of the rounds and events that you may also be attending in other settings. And we're also preparing some manuscripts to more carefully describe the process that went into this. I mean, we just had so much feedback, so much great information. It's almost entirely summarized in the report, but really I think we can give a more sort of deeper description of the process and really maybe reach a wider audience by also promulgating some of these findings in the scientific literature. So that's underway. Also, operational planning is underway, certainly within the Public Health Agency. And we've also, in fact, heard from some colleagues in provinces and territories that they're already looking at this report and the vision as a way to frame some of the planning that they're doing in their jurisdiction. Within the Public Health Agency, we're assessing the alignment of what we're doing. And in fact, what we're finding is that this vision is very helpful as kind of an umbrella or a framework for connecting a lot of activities already underway. So, for example, some of the things that we're already doing is completing a review of our own surveillance systems and assessing the degree to which they protect against, different types of risks and threats. So that's, I think, important. Also, working with partners on a modernized data sharing agreement, as I mentioned, in the context of Melissa, and advancing towards a more centralized, flexible way to intake data from partners. So, we've started to look at the activities happening within the agency and trying to kind of connect them and piece them in here, and also to look at gaps. Are there things that are in that vision or in these opportunities that we're not currently doing that represent, really perhaps an important area that if we want to get to that vision, we need to think about work in that space. So that's the second piece of our steps moving forward. And then the third is that we're actually actively now engaging with provinces and territories and other stakeholders about ways to really kind of think about these opportunities for action as a way to align our activities and really try and accelerate some of the more important opportunities. And so this is happening through different federal, provincial, territorial discussion tables. And also we are kind of bringing feedback to those tables, certainly somewhat periodically, about how we're seeing progress and opportunities in this space. So I think that's it in terms of the next steps. And I think I'll just close by showing you our final report. So next slide, please. So this is our final report title slide. So when it's available for you to download, you'll be able to see that along with the infographic you see on the right, summarizing that system of systems concept, along with the other characteristics of the vision, the challenges, and the opportunities for action. And I think, yes, and the links, of course, will also be posted on the NCCID website, in addition to on canada.ca, and shared through different types of fora like email and social media and so on. So hopefully you'll hear about it when it comes out. And then finally, I would just like to acknowledge, next slide, please, that it's been my really pleasure to play a leading role in this process, but there have been a lot of people that have done a lot for this to make it happen. Perhaps starting with the participants, maybe even some of you listening today, we had many people take time out of their day to attend consultations, to put information into the chat and the information online, or to come to some of the other engagements we have. So I want to thank all of those people very much. We would not be able to do this without that input. It's really all based on that. Also, the Surveillance Expert Roundtable members, I won't list them all. They're listed in the report. Very helpful as a group of experts in this space to bounce the ideas off and help to really distill down what's coming out of this. The National Collaborating Centers for Public Health were instrumental, really, in making this happen, coordinating the engagements and helping us to pull the information together, and also, of course, hosting wonderful events like this seminar series you're attending today. And then finally, many colleagues at the Public Health Agency and in the Health Canada's Communication and Public Affairs branch. There's been really a lot of work. This has been a very outward-looking, I would say, process in terms of engaging people across the country, but it has required a lot of effort within the Public Health Agency, and I really want to thank all those people for their time and contributions. Okay, and with that, I think I will hand it over to Chia Yu.
Thank you, David, for guiding us through the different components of Vision 2030 and also its development. The opportunity for action that you highlight also showcase some of the ongoing initiatives taken by public health partners across Canada. It is just wonderful to learn that there's already an ongoing progress contributing towards achieving the vision. We will now begin our discussion period. Please send in your question for Dr. David Brockridge using the Q&A tab. You're invited to ask questions in your choice of official languages. You can also choose to upvote other people's questions. Everyone is welcome to participate in the conversation, and we will try our best to address as many questions as possible. However, we may not be able to get to all of them. Okay, so let's see what we have in the Q&A tab. I already have a few questions. David, Christina is asking, given the 2030 timestamp, what is the goal or where we are wanting to be in 2030, which is less than 5 years from now?
Yeah, great question, Christine. It seemed very far away when we started, but it does seem a lot closer right now, doesn't it? I mean, again, the vision is aspirational. Really what we're trying to lay out are, in terms of the vision, are some key elements of where we want to get to and what are some of the most important aspects of, an ideal system. So, um, that's always the challenge with a vision. And we struggled a bit with this. If you go too far out in the future and you're too aspirational, it just seems not relevant to what we're doing right now. Of course, if you're too close to where we are right now, it seems impossible to think that you're going to get there. So, we tried to look out about 5 years. It's a little less than that now, as you point out, given that it took us a little bit longer perhaps to do this than we'd hoped. But I still think it's a reasonable horizon to look out that distance. And I think a lot of the things that we've talked about can happen. The challenge, of course, is, and this is, the reality where we are now, is that, we are in a situation where public health is a little more resource constrained than it has been, of course, coming out of the pandemic and with other competing demands that we see in the current economic situation. So, I think a lot of public health agencies are trying to actually, I wouldn't say limit, but they're trying to think a little more carefully about where they're allocating their resources. And actually, in fact, I think a vision like this is even more helpful in that context potentially, because we can't do everything, but it helps to highlight for us, I think, what are the more important things and creates an opportunity for us to really discuss, and coordinate as much as we can across different settings. Where do we want to really focus our effort in terms of improving public health surveillance systems?
Thank you, David. So earlier, when we have the poll question, people were wondering about the focus, the highest one was on the data. So the next question is, how will Vision 2030 address the challenges of integrating data from diverse sources while maintaining privacy and security?
Great question. Data integration is always going to be a combination of sort of technical and policy approaches, within some kind of a legal framework to allow you to bring data together for decision making or analysis of decision making. I think there are different ways that can happen. I mean, one way that we have identified as being promising, and in fact there isn't a pilot underway right now at the FPT level, is what's called federated analysis. So in that approach, the really disaggregated or raw data would stay within a given jurisdiction, say, for example, a province or a territory, or even at the federal level. But if you want to then integrate or bring it together, you would not actually pool the data. What you would do is have an algorithm that goes and visits the data in all the locations and builds an answer essentially for your analysis in that way. So that's not a solution to all problems, but it's one model that as I said, is being tested out right now with the federal government in some provinces in an experimental way, and we think there's potential there. So just to say, there are, I think you've highlighted an important challenge for sure, but there are technical solutions. But the one other thing I'd like to mention in relation to your question, Rena, is that there's also a public trust aspect to this that's really, really important, and I think comes back to the challenges and opportunities that we identified. No matter how we do this, it needs to be done in a way that's communicated clearly to the public and has public support. And, there have been a number of examples, there were some examples using mobility data, for example, during the pandemic, where, things were done above the board in ways that were, thought to be entirely transparent, but ultimately when they kind of got broader publication, people pushed back and were concerned. So I think it's really important when we think about data integration. It's important not only think about the technical policy issues, but also the public trust and communication aspect.
Thank you, David. I think our next question from Joe is probably has to do with the scope. How has the public health been defined in Vision 2030? Who does it? What is the scope, breadth, and depth of surveillance specific to public health? Is it everything and anything that pertains to health and health equity, including, for example, clinical care, tertiary prevention?
Great question, Joel. So always, I think important. How do you think about public health, and how do you think about public health surveillance? So We took a very broad view of public health here. So we're not just thinking about public health units, for example, we're thinking about any organization that might be involved in public health surveillance. So that would include public health agencies, could include health monitoring more generally by some organizations. We tried not to be too prescriptive here. I think a lot of what we've talked about and a lot of the people we talked with did come from the public health sector and were involved in what we might consider more sort of formal or traditional public health surveillance activities. But I think, I think your point is also alluding to that it's hard to draw a circle though. Just like it's hard to draw a circle around where public health ends, it's hard to draw a circle around where public health surveillance ends. And so, I don't know about tertiary prevention in this space, but certainly clinical data and clinical systems as they can provide data to population perspective, I think would be in scope here. So, and again, we struggle a bit with this. So I think your question really is on point. But I would say that for a lot of what we've described, we've tried to be as broad as possible. And so, including when we talk about the data that are important here, obviously, we're talking about data that are not just from public health departments or clinical settings. A lot of the data that's really important for public health comes from non-health care or certainly non-clinical settings.
Thank you, David. We have another question from Jay. Given the current resource constraint, how revolutionary are the changes needed to truly attain Vision 2030? Are there any small step-by-step action enough to work towards the goal?
Yeah, again, a great question. I think some of the things that we identified do not take a lot of resources. I'll put it that way. So there are a number of things. For example, the clarity of governance and purpose. This is not something that requires vast sums of money. I think also, some of the areas about building trust and engaging better with communities. They take resources. I'm not suggesting they don't, but so I think resources are always constrained. We definitely do seem to be going to a cycle now where they're more constrained than they have been in the public health sector, and so. As I mentioned earlier, I think a framework and a vision like this, it's helpful, sometimes even more helpful when you're trying to make hard choices about what you do, what you don't do, and where you put your limited resources. What is also, I think, important that we've highlighted here, though, is it's going to probably lead to a better outcome for all public health surveillance and all Canadians. Pardon me, is as we all make decisions about where to invest our limited resources in improving our surveillance systems, we do it in a more coordinated way, in a more collaborative and discursive way. And so really what the vision is trying to provide is some framework to help that discussion, help that movement forward. Will there be resources, for example, to build a new panorama? God forbid. Probably not. I don't see that coming. But I think there are a lot of smaller actions that can be taken. And that, in fact, was a bit of the motivation for our opportunities for action framing, was to really highlight specific activities that are not going to change the world, but they're moving us closer. And when you take them all together, we're making us move in the right direction. So to your point, I think you're right in noting that we're not going to be able to make probably major investments in the next little while in this space, but there are always resources being allocated. And what we're trying to point out here is that there are opportunities to allocate those resources in a purposeful way together that will move us in the right direction towards this vision.
Thanks, David. So we have a follow-up comment from Christina, and I received the most upvotes. So Christina was referring to a common sentiment that Canada is often referred to as a nation of pilots. While pilot projects are important for innovation and experimentation, does Vision 2030 offers any guidance or strategy on how to effectively scale up on those pilots?
Yeah, well, Christina, certainly I think you can see by the thumbs up on your comment that others agree, and I've certainly heard that perspective before. I don't know. I mean, the short answer is no. We don't really have a specific section of the report that talks about how to scale things up and how to avoid that problem. I mean, I guess my own personal take on that is that Part of the reason that happens is that I think the pilots are not always as coordinated and don't have the broader buy-in from the outset that they should. So I think pilots where somebody does something really exciting in one place and then you try and throw it over the fence, as it were, to others are very hard to scale. I think pilots where your work is in the context of a sort of some broader agreement about where to go to, and you have some already engagement with the places you'd like that thing to scale to, I think are much more likely to succeed than if you're, addressing a local problem and it seems exciting to you and then you try to scale it elsewhere. So, in that sense, I think a bit of the kind of the collaborative framework and this idea of having some clear sense of shared purpose of where we want to get to, I think could be helpful. But I think you've really hit on a true problem. And I think it really is about how the pilot is started, framed, and the collaboration around it. But that's a bit my take on it. We don't really get into that in great detail in the report.
Thank you, David. So following this trend about, taking action, there's a question in the Q&A tab that's asked in French. So if I can direct your attention to the question, it has to do with about changing the habit.
Okay, I can maybe just read it out for folks. So, plusieurs des aspirations proposées nécessitant un change d'habitude, de perspective et même des lois. Afin de faciliter l'adoption de plans, est-ce qu'il y a des activités prévues en plus des présentations telles que celle-ci? Avez-vous des exemples? So just to maybe paraphrase for folks who didn't understand my French. So, there's been a lot of, I guess, aspirations, goals proposed that would need a change in how we work, our perspectives, and maybe even laws. Sort of facilitate the adoption of this plan. Are there any activities planned more so than presentations like this? And do I have any examples? Yes, I'll respond perhaps just quickly in French. Oui, nous avons quelques rencontres ou quelques tables à niveau fédéral, provincial, où nous avons fait les mises à jour de cette plan et aussi d'essayer de trouver les opportunités pour les provinces, les autres qui travaillent en surveillance, de travailler ensemble d'avance quelques opportunités. Par exemple, il y a un projet de faire une exploration dans le contexte de vaccination, de la capacité d'avoir une fédération ou un modèle de fédération qui peut aider avec l'accès à la donnée jumelée dans plusieurs provinces. So I just quickly said, yes, in addition to these kind of presentations, we have been working, and I think I mentioned this earlier in the presentation, with leaders in public health from different provinces and territories and federal, provincial, territorial tables to really kind of put forward what we found in the vision and try to identify opportunities to align in some sense, as our opportunities in action are, things that are already happening with where we'd like to see this report go. And so one example, as I mentioned, is this ongoing pilot to look at the opportunity for federated data analysis in the vaccination space, where the Public Health Agency is working together with provinces and territories. So again, that's one example, and I think there are many other ways that we're looking to try and engage beyond just presentations, with really trying to almost figure out where are those potential areas of influence that we can lean into and see some progress.
Thanks, David.
Merci,
Earlier in the presentation, you mentioned that the Vision 2030 is meant to be aspirational. So one question from the audience is, what aspect do you think a new public health epidemiologist working on the regional or local level should be most optimistic about for the future?
Oh, well, that's an interesting question. Thank you for that, Ruth. I'm by nature an optimist, which, sometimes it's hard, but I do actually think there's a lot to be optimistic about here. I mean, one thing I think is that I take from all the consultations we did is like how many people across the country, from literally coast to coast to coast that we talked to, that are working in this space, are deeply passionate about public health surveillance and want to see it improve. So I think there's a lot of will, there's a lot of capacity. And, to be honest, I think there's a lot of opportunities to make things better. We've highlighted only a small number of them here. But I mean, as somebody who might be new to the regional local level, I think this is a bit of I think what we're trying to do here is give people a sense of well, how we think things ought to work. And it's an opportunity to look at how things are working, and be constructively critical. There's always an opportunity, I think, to improve what we're doing, whether it's like, the data management process or ways to bring in more standardization, or even thinking about how we're in the surveillance activities we're doing. How are we actually engaging with communities? Do we have a process in place to get input about what we're actually following in this surveillance system and how we communicate information back to communities? So I would encourage somebody in that role to take a look at this report as a way to think about where we'd like to get to, and as a way to bring a lens back to what you're doing in your day-to-day practice, and think about what is it that you can do, not to some extent individually, but also as an agent of change within your organization, and knowing that there are people across the country that are trying to row in the same direction. And I think that's sometimes quite helpful. And you can also be networked around that in terms of your existing networking opportunities. This creates a kind of clear framework or structure to start having some discussions about where you can lean in and really affect change.
Thanks, David. Given the time, I think we still probably have time to fit in one more question. So this most upload questions from Adam. Recognizing the difficulty in data sharing with international partners due to limited or inconsistent legal and policy enablement, to what extent should international collaboration be prioritized to strengthen early warning systems, given the history of disease spread through international travel and cross-border mobility?
Interesting, Adam. That question did not come up an awful lot in our consultations within the country, but there was some discussion about that in our CIHR consultation with international experts. I think, case level data, international sharing of case level data is challenging for sure. Part of that is just the way that public health reporting works and some of the delays, because it's going to be the federal level that's going to communicate internationally for the most part on case level data. I think we talked about a lot of things though that are meant to speed that process, and also ensure that at the end of the day you have a little more information available in terms of what you're doing. But I think this is also an area where we need to look at other approaches to surveillance, not just case-based surveillance, but certainly like event-based surveillance. And Canada certainly has had a lot of experience in that space with GFIN and other activities. But I think, as you're seeing probably from the attempts to negotiate a new pandemic treaty, there also needs to be some agreement about how we want to work together internationally, and that's not always so clear. So I guess just to take a step back from this, I think I was very encouraged in the COVID pandemic by the amount of kind of work done to create environments where you could share some level of data. Interestingly, a lot of it was more ad hoc, of people scraping systems, and like the Johns Hopkins dashboard, for example, and other work happened in Canada to create open data repositories. So I think there's something to learn from that in terms of how, as a public health community, we could be much better about making our data visible and accessible. Of course, it has to be done in a way that protects privacy and security and meets legislation. But I think a lot of the sort of the technical examples that we've talked about in the report show how you can speed up that process. And I think if we had a better way of just making those data available transparently in a machine readable format, that would really facilitate with more international communication of surveillance data. So those are all things that can be done and are being done to some extent. But to your question, this was something that was not so core to our report, although it is mentioned, I think, and it is addressed to some extent. And if you're interested in a little more kind of discussion on this, I direct you to the CIHR Best Brains report, which I think had a little more discussion on this area.
Thank you, David. I think that's all the time that we have for today's Q&A section. So I would like to begin by thanking all of you for joining us today. And also, of course, to David for presenting Vision 2030. I'm sure a lot of us are looking forward to read the final report that will be released on Canada.ca soon. So here's a reminder for the recording for today's seminar and presentation material will be accessible for viewing on NCCID's website in a few weeks. We will also be sharing the links to the Vision 2030 final report once they are made available. In the meantime, you could follow the social media of Public Health Agency of Canada for updates. The links are provided in the chat for you. Our next seminar will take place on Tuesday, March 25th, from 1 to 2 p.m. Eastern Time or 12 to 1 Central Time. More information will be shared on the NCCID website shortly. If you have any question about the Surveillance Events Seminar Series, please visit our webpage at nccid.ca under the Surveillance Events Seminar Series for more information. Before we end today, we would also like to share the information of another seminar with you. It is actually taking place 30 minutes from now. NCCID and the Canadian Water Network will be presenting From Sewers to Solutions, Transforming Public Health Through Wastewater Surveillance Success Stories. I think that's really aligned with what David just presented. We already have ongoing progress working towards Vision 2030. So Dr. Natalie Pristachsky and Dr. Robert Delatola will highlight wastewater surveillance success story from across Canada. You can scan the QR code on this slide to register for the seminar or follow the registration link posted in the chat. Last but not least, please take some time to complete our survey for today's presentation. You can scan the QR code on this slide to access the survey or look for the link in the email that will be shared with you shortly. In the post-seminar survey, you will also be able to request a letter of participation for your attendance today. That concludes today's seminar. Thank you all very much for joining us today.